Welcome back to Neurodegeneration Awareness and Artificial Intelligence. I'm Sukant once again, and with me is Kanak Chaudhary once again, who has been working on neurodegeneration research and aspires to do PhD in Europe in neurodegeneration. Welcome, Kanak, to the show.
Thank you, Dr. Sukant. It's a conversation that's both timely and critical, and given the demographic shifts we are seeing globally.
Indeed, Kanak, the developing world encompasses a vast array of cultures, socioeconomic conditions, and healthcare infrastructures. What would you identify as some of the most significant overarching challenges in raising neurodegeneration awareness in the developing world?
Uh, if I say the challenges are multifaceted, firstly, basic awarenesses of neurodegenerative conditions is often very low, and symptoms are frequently misattributed to normal aging, a- other illnesses, or even spiritual causes, as we discussed before. Secondly, stigma surrounding mental and cognitive health is often more pronounced and deeply ingrained, uh, preventing open discussion and help seeking behaviors. Thirdly, the access to healthcare, particularly specialized neurological care and diagnostic facilities, is severely limited, especially in rural and underserved areas. And finally, I would say competing public health priorities such as infectious diseases and other maternal child health related problems often overshadow the urgency of addressing chronic conditions like neurodegeneration.
Very well put. I think you've brought in a condition which is not discussed: maternal child health issues, infectious diseases, even road accidents. How many people die with because of road accidents? There is also a lot of violence. All these issues become so much profound that caring about neurodegeneration, which is such a big killer, it destroys quality of life, becomes takes a back seat. So you've hit the hammer on the nail. Now, the issue of access to healthcare, right? The access also seems to be particularly critical. How does the lack of infrastructure and specialists compound the problem of low awareness?
Yes, I think it creates a vicious cycle. Low awareness means less demand for specialized services, which in turn leads to fewer resources being allocated. And the scarcity of neurologists and geriatricians in many developing countries means that even when individuals or families suspect a problem, assessing a qualified professional for diagnosis and guidance can be incredibly difficult, if not impossible, especially outside major urban centers.
That's great point that you mentioned. Now, AI, with its potential for scalability and reach, can be strategically deployed to overcome some of these awareness barriers in the developing world. What's your opinion?
So, AI offers some exciting possibilities like mobile technology penetration is high in many developing countries, even in resource limited settings. And AI powered, like culturally and linguistically appropriate awareness, camping deliver via mobile platforms can also be a helpful part. Using SMS or even basic features, phones could reach vast populations. Also, the AI chatbots could provide initial information and answer basic questions about symptoms in local languages, potentially overcoming stigma associated with direct human interactions.
That is true. It's a very compelling idea. You mentioned stigma associated with direct human interaction. So AI can be physician, best friend, counselor. Now, leveraging the ubiquity of mobile phones, how can AI help in overcoming lack of access to specialists in these regions?
So, in that case, AI driven diagnostic support tools could be developed for use by primary healthcare caregivers or workers, or even community health volunteers. And these tools could analyze basic patient information and flag potential cases needing referral, even if a specialist isn't immediately available, which will be very helpful. And telemedicine platforms enhanced with AI could facilitate remote consultations with specialists in urban centers, which will bridge the geographical distances. And AI algorithms analyzing basic neurological assessments conducted by non specialized uh, could also provide valuable insights to the patient.
That's very good. So there are some issues I'll not go into depth because we have been covering in different countries. These are related to data quality, which we have already discussed with Kanak. We had discussed with other experts also. There are aspects of cultural sensitivity which are very significant, and there is a role of international collaborations and partnerships, which I'll be discussing even further in the talk extensively. So those are all very relevant to developing countries, but I'm skipping those things. I'm coming to some important aspect. So Kanak, finally, sort of what key recommendations would you offer to governments and international organizations looking to leverage AI to improve neurodegeneration awareness and care in the developing world?
So, prioritizing neurodegeneration within national health agendas or allocating resources for research and digital health infrastructure is very crucial at this point. And governments should foster an enabling environment for responsible AI innovation, including data governance frameworks that address privacy concern while facilitating data sharing for the public good, and investing in digital literacy programs and promoting public private partnerships to develop and scale accessible AI solutions are also very vital. And international organizations can play a key role in funding research, facilitating knowledge transfer, and I would say supporting capacity building initiatives in many developing countries.
Yeah, this has been very insightful, Kanak. Thank you for being on the show. I'm really thankful for your insights into this matter. Thank you very much. Now, I would
Thank
end
you.
the show. Yeah, thank you, Kanak. I'll end the show, and I would urge the listeners to tune in again and understand neurodegeneration awareness in various countries, various technologies, various solutions. As we move a geographical needle to other part of the world, we have developed South Asia, we have been discussing Southeast Asia, discuss Africa, we've discussed Middle East. We'll come to challenges, data access in Western Hemisphere. We'll come to the issues in other parts of Asia. We'll come to some of the very developed parts of non-Western Hemisphere also. So we'll discuss all this gamut. We'll then move on to technology. We'll move on to industries working in it. We'll talk about other challenges so we can together come up with a solution. The purpose of this podcast is not just communication to laymen, which it is an appeal to specialist stakeholders so that we can come up with solutions as fast as possible and at as affordable rates as possible. Thank you very much. Stay tuned. Bye bye.